Director of the Centers for Disease Control and Prevention.
Antibiotic resistance could affect any of us. In fact, 2 million Americans get resistant infections each year. 23,000 Americans die from infections each year, resistant infections each year, and another 14,000 Americans have deaths. I'm an infectious disease physician. I've treated patients for many infections, and I've also treated patients for whom there were no antibiotics left. I felt like a time traveler, going back to an era before antibiotics. We talk about the pre-antibiotic era and the antibiotic era. If we're not careful, we will soon be in a post-antibiotic era. And in fact, for some patients and some pathogens, we're already there. Antimicrobial resistance is a big problem, and it's getting worse. Antimicrobial resistance has the potential to harm or kill anyone in the country, to undermine modern medicine, to devastate our economy, and to make our healthcare system less stable. Confronting this has the ability to protect Americans from the moment they're born and throughout their lives. But every day we delay, it gets harder and more expensive to reverse it. But it's not too late. We can shrink the numbers and control it. If we don't, then common infections like urinary tract infections may be very difficult to treat, and we may be, many of us, where I've unfortunately been in that time machine looking at what a world was like before antibiotics.